Through these next training videos, we're going to be showing you techniques of administering medication towards your clients. Now, in real life scenarios, it's really important as a carer, you are protecting not just yourself, but also your client by wearing your gloves and your apron. Now, the aprons are quite noisy, so for sound purposes, actually, I'm not going to be wearing it just for this training video. So we're going to be starting off, are you happy to do an eye drop first? With administering an eye drop. Now, before we administer the eye drop, there's a couple of things that we just need to be checking. We're looking at the name and the strength on the box. And I also just want to double check the expiry date on the bottom and just make sure that that information all matches what we've got in the bottle. Also, another thing to be checking is on the lid, we've actually written the date that we first opened this bottle. Now, the reason we write that date is because on some medications it will say discard after 7 days or 14 days, and it just gives us that information there to hand. Just want to put that there. Just want to take a tissue. Lovely, and I'll just take a tissue as well. I'm going to place a tissue on the table. That's going to be my clean working area. And I'm going to take the lid off, and rather than keeping it in my hand where I can then bring bacteria, I'm going to place it onto the side and pop that onto the tissue. Now, the reason I'm not putting it straight down onto the tissue is we can pick up tiny bits of fibre, which we could then transfer onto the bottle and then later into the eye. So it's on the side. Yep. And what you'll notice in a moment is actually when I introduce the drop to Lenny, I'm not going to come straight towards her face because you'll notice that somebody will recoil and try to move. So I'm actually going to come standing side on. I'm going to use my index finger and create just a small pocket underneath with that lower lid, and the drop is going to go in there. Now I'm going to need Lenny just to tilt her head back. That gives me a good position to pop that drop in. Now, with a client, they may not be as flexible as what Lenny is here. As a carer, it's really difficult that we try not to offer with that tilt position because we can then damage the neck. So I'm going to bring my hand over the back of Lenny's head. It just stops her from seeing it and blinking. Create that pocket and the drop goes in the eye. And then Lenny can wipe away any excess. To do the other eye, what I don't want to do is put my hand across her face. Ideally, I would go around the other side, again, from the back of the head, so I'd have to swap my hands over. Once we're done, we can then pop the lid on and put the eye drop away. When it comes to administering an eardrop can feel quite cold to the ear, so do you mind if I just give that to you to hold on to? Yep. Otherwise that'd be really uncomfortable and painful. Now, when we're administering an eardrop, the client's position, if you do it Lenny, will be across towards one side. Now, it's important that the head and neck is supported, so it might be that we do this first thing in the morning while the client's still laying in bed. Otherwise, we might introduce a pillow or a cushion just to take the weight of the head to support the neck as well. Okay, lovely, thank you. As with any medication, you're checking the name, you're checking the strength, the expiry dates. As the eye drop bottle, exactly the same, we'll also be checking the date that this was opened. So to get that drop in and help it go down, we will take the ear and we'll pull it gently back and up. Now that straightens that inner ear area. Just pop your head to the side, so I take it back and up. We're going to place one drop inside the ear. Then I'm going to ask Lenny just to bring up her finger and just press that soft section to the front of the ear. And that will pop any air bubbles, allowing that drop to drain down. Now, once the drop is in the ear, we're going to recommend or ask the client to keep their head in this position as long as they can comfortably. It's around 5 minutes. That allows the drop to get deep into the inner ear. It becomes absorbed. After 5 minutes, the client can then bring their head upright. You might get some surplus medication dribble out the ear, so you might just want a little tissue just on the shoulder there as well. Now, if we need a drop in the other side, we're going to ask our client to keep their head upright for 10 minutes. And then we would repeat the process. I would go the other side, Lenny would bring her head across, drop goes in, and we'd be waiting for a further 5 minutes. So in theory, when it comes to administering an eardrop, it's actually about 20 minutes, isn't it, that we would recommend for those. Moving on, we're going to be looking at administering the nasal spray. So as we have before, we're checking the name, the strength, the expiry date and that opening date. I would still place the lid in the position on the side. So before I insert the bottle to Lenny's nose, I would ask her to blow her nose, just clears the nasal passage a little bit. I'm going to ask her to bring one hand up just to block the opposite nostril. Now you'll notice Lenny's got her head in that upright natural position. We don't need the head tilted backwards. Slightly forward would be absolutely fine as well. We're just watching that natural breathing pattern. We don't need a great big breath. It would just sit within the nostril itself. For training purposes, I'm going to keep the bottle down here. As she starts to take that gentle breath in, I just give it a little squeeze, and that spray would then be inhaled gently.